Thank you, Mr. Chairman, and thank you, Secretary Becerra, for joining us today. Right now, I'm very concerned with President Biden's border crisis and the surge of unaccompanied minors that we've heard about today, unaccompanied migrant children, and it has overwhelmed the Border Patrol and other federal agencies. The current humanitarian crisis at our southern border could have been avoided if the Biden administration hadn't undone years of work of the Trump administration to establish robust enforcement mechanisms, close regulatory loopholes, secure agreements with Mexico and Central American countries, and constructed vital security infrastructure like the border wall. The previous administration's approach was an innovative and well-coordinated effort between federal and foreign agencies and foreign governments. Mr. Chairman, I'd like to ask unanimous consent to enter into the record an article from the National Review entitled "How Trump Got Control of the Border." In contrast, the current administration has rejected these common sense policies, which were clearly working. Not surprisingly, the result is a crisis that far surpasses anything we ever saw under President Obama and Trump. The Biden administration has a responsibility to acknowledge that what we are seeing at the southern border is indeed a crisis and that its misguided policies are to blame. The Biden administration also has a duty to address the downstream effects of the current border crisis. We've seen local news reports from Washington and Texas about foster youth being displaced and forced to vacate their residence in order to make room for unaccompanied migrant children. This is extremely alarming, especially given the already limited available of more permanent placements for foster children. Mr. Secretary, what's the extent to which the surge of unaccompanied minors at the border has impacted or burdened the capacity of state child welfare agencies to place foster children? And then as a follow-up, has any child in foster care at a not-for-profit or community-based organization been displaced by HHS contracts to house unaccompanied minors?
Congresswoman, thank you for the question. And let me, as I said to Congressman Brady, assure you that we take every step necessary at HHS to make sure that the work we do with the unaccompanied migrant children does not impact the ability of the domestic foster care system to care for our children who need that foster care service. And we have done a tremendous amount of work to try to make sure that at the same time at the border, we are relieving the Customs and Border Protection Service from the need to try to care in what are essentially adult detention facilities for children. And so we've been able to place those kids into our custody and keep them safe and healthy the way the law requires us to.
Thanks. And Mr. Secretary, would you agree that it's important for HHS and the FDA to require rigorous reporting on drugs developed specifically for women so we can clearly understand potential risks or complications to women?
We certainly want to make sure that we follow the science, and I think FDA tries to do that as best it can. And we are always going to try to make sure that we put out the type of medicine that has been proven to be safe and effective. And that includes whether it's for women or for men. We want to make sure that what we can do is make sure that Americans can trust our healthcare system.
Thanks. And I think we should prioritize better data collection on the chemical abortion pill prifamestone then. In addition to killing an unborn child, this drug can cause heavy bleeding and serious infections in women. And yet, as of 2016, providers of mifepristone are only required to report patient deaths, but not to report hospitalization, transfusion, or any other serious events. Will you commit to prioritizing better data collection for this drug so we'll have a clear picture of the potential risks it poses to women?
And Congresswoman, as you know, when the FDA acts, when HHS takes action on involving prescription medication, we follow the science, and certainly we'll make sure that everyone is accountable because we have to ensure that the public has confidence in the system.